Today, we're going to be talking about the top 3 Medicare mistakes almost all new enrollees make. My name is Josh Popek. I'm with Brock Insurance. And we're really just going to go over some what I would say is very basic knowledge. But a lot of Medicare beneficiaries, they seem to get it just a little bit confused whenever we talk about this stuff. Now, number one of our top 3 mistakes that new Medicare enrollees are going to make, assuming Medicare covers everything. Medicare does not cover everything, unfortunately. For whatever reason, there is a very common misconception that Medicare covers every single thing. Now, I think what a lot of people are used to, they get accustomed to their health insurance that they have with their employer, covering their health, covering their dental, covering critical illness protection, covering prescription drug coverage. That's not the case. Whenever you are new to Medicare, you're going to get a red, white, blue Medicare card. All that's going to cover is just the basics. Now, whenever I say basics, and we're going to eventually get to it, but I'm just talking pretty much about your health insurance. That's all it's going to cover right out the door. Now, Medicare, original Medicare does cover hospital and medical, but it doesn't cover everything. So we go back to talking about employer health insurance. Really what I'm looking at is dental, critical illness protection, vision, hearing, drug coverage. Whenever you turn 65 and you do get the red, white, blue Medicare card, none of that other stuff is going to be covered. Now, there's also a lot of deductibles, a lot of copays. I got this underlined 3 times for a reason. The biggest gap in original Medicare is going to be the 80-20 co-insurance. Now, I know we've had some videos in the past talking about this. I do want to really just go back a little bit. Let's just say if you had a doctor's office visit, if that was $100, Medicare is going to cover 80% of the cost. You'd be left with 20%. Now, a $20 copay at the doctor's office, that's not bad whatsoever. But if you get in a more major medical situation, like a knee replacement, for example, if that's $100,000, Medicare will cover 80%, $80,000, pretty large chunk, but that's still going to leave you responsible for the other $20,000. Now, I don't know about you. I don't have that kind of money laying around for medical bills. That's exactly where we come in to help out at. But then we've really hit these points. No dental, no vision, no hearing, no drug coverage. Medicare enrollees, for whatever reason, that common misconception we go back to, drug coverage is not included. You do have to make an election on a drug plan to make sure that your medications are covered. But also another thing a lot of agents still do not talk about, if you're not taking prescription medications, you still need to have some form of credible coverage or a Medicare prescription drug plan. Moving on to number 2, waiting too long to enroll. This happens so much. I wish I could talk to every single person that was new to Medicare. That way we could avoid it. A lot of people, they wait entirely too long to enroll to their Medicare. Does not always automatically start for a Medicare beneficiary. So let's just say, for example, and I've actually got the examples, some of them down here, but really what we're looking at in this scenario, let's say if you're still working, if you have credible coverage, if you're not drawing Social Security income after you turn 62 and you're turning 65, if you're not drawing that, you're not automatically going to be enrolled into Part B. If you delayed your Medicare Part B, you will have to actively enroll. Let's just say in this scenario, you decided that you wanted to delay drawing your Social Security income, which is completely fine if you know the full facts behind it. Let's just say you're 67 years old, you had the option to start drawing that 5 years ago. If you decided to delay that and you do retire, you no longer have your health coverage, you will have to make an appointment with Social Security, talk to one of our agents to tell you the easiest process on how to get enrolled into Part B of Medicare. There's just so many different nuances whenever it comes to this. We don't want you to be confused. We try to make it as simple as possible. Now, moving on to the next point, missing enrollment windows. This is, if I'm going to be completely honest with you, this is going to be one of the things that is one of the easiest things to avoid. But a lot of people, they're just not fully educated on the way that they should be. Key enrollment periods. We're talking about your initial enrollment period, the annual election period, your open enrollment period. There's so many different dates. It can get very confusing very quick. But let's just say if you miss your initial enrollment period, especially whenever we're talking about Medicare supplements, the open enrollment period. If you miss that window, there's no guarantee that you can get that type of health coverage. We don't want you to miss that window. Now, this is a really big thing. A lot of people, they believe that I'm working, I'm 65 years old. I don't need to know the ins and outs of whenever it comes to my Medicare options. You really should know your timeline before you do turn 65. That way you can avoid any kind of enrollment periods or penalties, better yet, enrollment penalties. That way you can avoid that. It can become such a headache after you do decide to start your Medicare. The penalties, they add up over time. They go up. We don't want that to happen to you. Moving on to point number 3 and our final point, making decisions based on premiums. You may talk to somebody that's going to be in a call center way out in the middle of nowhere, and they're going to bring up an option to you, and it sounds really good. It is a good option, but if you're turning 65, if you're in that gold window to make whatever health decision for your, or whatever health insurance option for yourself, when you're in that window, we highly advise to make sure that you are talking to a licensed agent. Obviously, number 1, but number 2, make sure you got the full details on it. Some people like to bring up an option. It is a very, very low monthly premium. Everybody likes to save money. I love saving money. If I can get my car insurance cheaper, it sounds good, but I definitely need to know the details on what all it's going to cover, what all I'm expected to be out of pocket, and it really relates to health insurance the same way. The cheapest option isn't always going to be the least expensive. Up front, it may be. You may be like, hey, this is great. I'm not having to pay a whole lot. But the older that we do get, and I know I just talked about car insurance, I relate people a lot to motor vehicles. The older that we get, the more miles that you put on your car over time, the more you're going to have to go to the mechanic. I can guarantee you something eventually will come up. Hopefully it's minor, but you definitely need to make sure that you do have even the minor stuff covered in that scenario. Paying more up front gives you more predictable spending over time. Now, if an agent were to talk to you about a Medicare Advantage plan, which we do offer, they are great fits as long as they are covered the correct way. But if they do bring up a Medicare Advantage plan, you definitely need to know what your maximum out of pocket is. You need to know what your copays are. You need to know what deductibles are. If you're a very, very healthy individual, that's great. But over time, if you start getting sick, if you start going to the hospital more, if there's a catastrophic scenario that comes up, you could be liable for that full maximum out of pocket. Now, the Advantage plans today, what we're seeing average nationally, that's around $8,000. If you're just living off Social Security income and you happen to hit that maximum out of pocket, that's a large chunk of change. We don't want you to be responsible for that. That's why we recommend you're in your open enrollment, you're in that golden period to make whatever health decision or whatever health insurance decision that you do want to make. Just make sure that you're making the right one. Spending a little bit of monthly premium to avoid having to spend a whole lot more further down the road, that makes the most sense. It absolutely makes the most sense. If I could tell somebody that between your health insurance premium this year as opposed to what it could look like 10 years down the road, if I told you that your expected cost out of pocket for a full calendar year for your health insurance was around $3,000, if you go this route, you could potentially be out of pocket $8,000. You kind of got to weigh the options. You got to see what's the best fit for you. I totally understand that, but just make sure that you are getting all the information, that you know exactly what's available to you, and just ultimately make sure you're making the right decision for you. So in closing, today we talked about 3 Medicare mistakes almost all new enrollees make. My name is Josh with Brock Insurance. Medicare is a journey. Don't get lost. Thank you.